Hi everyone, welcome to Module 4, Planning and Implementing Social Marketing. I am Rosario Dizon and I'll be discussing Lesson 1 of this module entitled Different Models as Practiced by Different Development Organizations. In our previous lessons, we've learned that social marketing is an approach that uses commercial marketing strategies to drive behavior change around a social problem or issue. So, developing a social marketing plan can help us be more strategic and audience focus in our communication efforts and achieve better results. Now, for the lesson's objectives. At the end of the lesson, you should be able to describe or expound on different models by which these organizations implement social marketing programs. And also, at the same time, from these models, we can draw our own framework for the development or planning and implementation of our own social marketing program later on. In the next slides, I'll be introducing you to some notable models, frameworks for social marketing practiced by different organizations such as the World Health Organization, UNICEF, and among others. So we have here the Combi model, the Cube model, the 8-step communication planning model, and the P process. Let's now discuss the Combi model. So, COMBI stands for Communication for Behavioral Impact, and it was developed and ideated by Dr. Everald Hussein, who is a senior communication advisor for famous development organizations such as the WHO, World Health Organization, UNICEF, and etc. The challenge for the public health issues is not only to motivate the adoption of new behaviors, but to also ensure that the new behaviors are maintained. In this context, traditional approaches such as IEC or information, education, and communication had limited impact. So, drawing from the success of the private sector's combination of market research, advertising, what else? Um, Public advocacy, direct marketing, personal selling, and etc. The World Health Organization began using this approach or adopted this approach in 2000. Next, as I've mentioned earlier, COMBI stands from Consumer Communication, linking education and information with marketing. So this model also can be used by communication, health education, promotion, social mobilization staff who will follow a well-defined, robust, systematic framework such as this model. Uh, Combi is actually a process that strategically blends a variety of societal and personal influences and communication interventions to encourage people to adopt and maintain recommended healthy behaviors. So this begins with the people and their health needs and focuses on specific behavior results expected in relation to these needs, wants, and desires. Then this model also recognizes that there is no single magical communication intervention, and instead it relies on a strategic combination of the following 5 interrelated communication strategies. So we have here the public or administrative mobilization, public relations advocacy, highlighting particular behavior on the public and administrative program management agenda via various key channels such as mass media, news coverage, official memoranda, community leaders' agenda, and etc. Next is community mobilization, including the use of participatory research such as community group meetings, partnership meetings, uh, traditional media like such as posters, videos, home visits, and many more. And the third one here is the advertising or sustain appropriate advertising. We have here, I would like to give an example of a successful social marketing of the Department of Health, the Yossi Kadiri, as it was developed in 1994 during the leadership of the former Secretary Juan Folier. And this campaign called Yossi Kadiri seems to be very successful until now. I mean, successful, and it is being used by the department until now. So you see, this is a specific example of social marketing that being sustained and use appropriate ways like the massive, repetitive, intense, persistent, or this slash dash RIP, six seats, and many more. And we have here the personal selling, interpersonal communication, wherein it is like counseling at the community level, in homes, and particularly at service points with appropriate informational literature or educational materials, including careful listening to people's concerns and addressing them, and etc. We have also, lastly, the point of service promotion, emphasizing easily accessible solutions or health products to health problems. So remember during the COVID-19 pandemic, we have, I mean, one of the ways to prevent COVID-19, we have to have a stronger immunity and also observe proper hand washing. So you can see this familiar IEC materials in public spaces such as public toilets, in malls, etc. So this is example of point of service promotion that is easily accessible to us or to people. Next is we have how to design a combi plan. So first of all, we develop the overall program goal that this approach will help achieve. So, for example, in this statement, to contribute to the elimination of HIV/AIDS or a specific goal like malnutrition, etc., and location, like for example, Philippines by the year 2030 or whatever time would you like to choose. And next is state a behavioral objectives that is SMART. Like SMART stands for, we know that it's specific, measurable, appropriate, realistic, and time bound. So, for example, to in the statement, to motivate numbers of men in the age group of 17 to 25 to use condoms each and every time they have sex, for example. And also, we could have use the situational marketing or market analysis via the precise behavioral goal. We can also use consumer-oriented tools such as the TOMA or the top of the mind analysis, DILO, day in the life of, to that it can help understand the range of personal and social factors that influence the achievement of these behavioral objectives that we stated earlier. Next is we also have to craft an overall strategy for achieving the stated behavioral results. So these are the description of the general communication approach and actions necessary for achieving the behavioral results, and is presented as below. We can have this following: restate behavioral objectives based on the situation analysis, set out of communication objectives, outline communication strategy for achieving communication results, and many more. So next is also in Combi Plan we have plan of action. So this is a description of the integrated communication actions to be undertaken with specific communication details in relation but not exclusive to public relations, public advocacy of your own social marketing. So the plan should consist of the following elements: management and implementation of the approach. Next is monitoring and evaluation plan, implementation plan, and lastly, the budget. So for more information about the Combi model, you could access on the web, or you can search on the web the Combi Institute, and you could see there the videos of Dr. Hussein himself explaining further about the model and how it is being applied also in particular health issue or social problem. So in the next video, I will talk the cube model, the eight step planning model, and the P process.